In this presentation, we will focus on defining obstructive sleep apnea along with its associations, risk factors, and treatment, while giving special attention to its ocular associations. Sleep apnea is defined as a disorder in which a person frequently stops breathing while sleeping. This condition is specifically caused by an inadequate motor tone of the tongue and airway dilator muscles, leading to the individual frequently waking up throughout the night. In addition to continuous poor sleep and fatigue, it can lead to serious systemic conditions. It can lead to cardiovascular problems such as hypertension, heart attack, atrial fibrillation, and tachycardia, central nervous system complications such as stroke, epilepsy, and an increased chance of motor vehicle accidents, and it is also associated with the development of diabetes. Within the United States, it is estimated that roughly 3 to 7% of men and 2 to 5% of women have been diagnosed with obstructive sleep apnea. This tends to impact individuals with obesity at a higher rate than other populations, as the condition is found in 41% of those with a BMI over 28, and a study found that 78% of patients reporting for bariatric surgery due to morbid obesity also had sleep apnea. Additional risk factors include individuals that are prone to excessive snoring, metabolic syndrome, daytime sleepiness, and milder forms of insomnia. Those with higher plasma levels and elevated CRP values are also at risk for sleep apnea. Hypertension and AFib also have a strong association, as mentioned. The main sign of a person suffering with sleep apnea would be the presence of excessive snoring. It may be easier for this to be noticed if the individual is sleeping beside a loved one who notes the behavior. For those sleeping alone, they may notice waking up frequently in the middle of the night or gasping while sleeping. Excessive sleepiness during the day, difficulty with morning headaches, and general irritability are also signs that lead towards a diagnosis of sleep apnea. Associations with this condition, as mentioned, include obesity, larger necks, crowded airways and tonsils, high arched palates, and this lack of oxygen in the airway may also lead to hypoxia, which can lead to increased risk for artery disease, heart failure, and stroke, amongst other complications.
Now we will explore some of the ocular associations related to obstructive sleep apnea, but not necessarily caused by it. Perhaps the most common association with obstructive sleep apnea is floppy eyelid syndrome. It is most common in obese males, and it's the weakening of tissues which has caused hyperextensible lids. Ocular surface disease, nocturnal lid eversion, eyelid ptosis, and papillary conjunctivitis are related to floppy eyelid syndrome, as well as keratoconus as a possible sequelae from rubbing during nocturnal eversion. Some of the statistics include 96% of floppy eyelid patients have obstructive sleep apnea, and 2 to 5% of obstructive sleep apnea patients have floppy eyelid syndrome. In severe cases of obstructive sleep apnea, the incidence of floppy eyelid syndrome increases to 40%.
Glaucoma is another strong association with obstructive sleep apnea, but the association is pretty unclear due to lifestyle diseases which also impair blood flow to the optic nerve, such as diabetes, hypertension, and obesity, which are confounding factors to knowing the true association with obstructive sleep apnea. But we do know glaucoma is a disease of the optic nerve, which is the second leading cause of blindness worldwide, and that obstructive sleep apnea predisposes the optic nerve head to ischemia and damage through episodes of hypoxia, hemodynamic changes to retinal blood vessels, oxidative stress, mitochondrial dysregulation, inflammation, which overall is just going to make glaucoma a much likely possibility. We do know that glaucoma is going to be more prevalent in untreated obstructive sleep apnea groups versus treated or non-obstructive sleep apnea groups, but still we do not know what the true association is, but it is somewhat strong.
Obstructive sleep apnea leads to hypoxia, where an increase in CO2 concentration may lead to dilated blood vessels, increased pressure, and that leads to optic disc swelling or papilledema. Obstructive sleep apnea is highly correlated to diabetic eye disease, or a group of eye problems that affects people with diabetes. These conditions include diabetic retinopathy, macular edema, cataracts, and glaucoma. People that have both type 2 diabetes and obstructive sleep apnea are at an increased risk of developing diabetic retinopathy, which is the most common form of diabetic eye diseases. Damaged blood vessels may leak fluid, which causes swelling. New, weak blood vessels may also begin to grow, and these blood vessels can bleed into the middle part of the eye, leading to scarring and causing dangerous high pressure inside your eye. Other less common associations with obstructive sleep apnea include keratoconus, rosacea conjunctivitis, and blepharitis. Patients with these ocular signs should be questioned about their quality of sleep and referred to a sleep specialist if appropriate.
After considering the associations, we now want to discuss the things that are known sequelae of this disorder, namely a non-arteritic ischemic optic neuropathy, central serous retinopathy, and retinal vein occlusion. Of the things that can occur with obstructive sleep apnea, non-arteritic ischemic optic neuropathy is potentially the most devastating as it can cause permanent vision loss. It is acute and non-progressive and results from occlusion of the short posterior ciliary arteries which surround the optic nerve, thus leading to ischemia of the optic nerve. Patients on multiple hypertension medications are going to be the most at risk for this disorder, and of the people that experience NION of one eye, there's a 15% risk of it also occurring to the other eye in 5 years. It is the most common cause of optic nerve injury, and OSA just increases the risk for it. Most people will experience it upon awakening, or they'll notice the symptoms when they awake. And with CPAP therapy, there's not any greater risk than there is in a non-OSA population. Central serous retinopathy is another possibility with OSA. It is a relatively acute idiopathic detachment of the retina secondary to serous fluid collection beneath the retina, and repeated recurrences can result in irreversible vision loss. The reason for this, or the supposed mechanism for why it happens, is an increase in circulating catecholamines such as epinephrine and norepinephrine, which will decrease retinal barrier integrity, resulting in subretinal fluid accumulation. Central serous retinopathy patients have a 61% higher prevalence of having obstructive sleep apnea than non-CSR patients. And anecdotal evidence suggests that it can resolve quicker if the OSA is treated. Retinal vein occlusion, also known as RVO, represents the second most common cause of blindness from vascular disease in the retina after diabetic retinopathy. And this is the result of occlusion of the retinal vein which can result in backflow of blood and cause intraretinal hemorrhaging, which can result in irreversible vision loss and neovascular glaucoma. And it's very highly correlated association with obstructive sleep apnea, or it can also be a direct sequelae of it. Estimates are pretty variable as to how often it occurs, ranging from 37% to 91% of RVO patients having obstructive sleep apnea. Also, similar to NION, symptoms are usually noted upon awakening, and the mechanisms are also pretty similar as they are both obstructions of blood vessels, and for retinal vein occlusion, that's the result of increased intracranial pressure or the central retinal artery compressing the central retinal vein, or from microvascular stagnation for a branch retinal vein occlusion.
The ultimate goal in the treatment of obstructive sleep apnea is to eliminate the obstruction in the airway, thereby effectively reducing the hypoxia. Most notable is the addition of a continuous positive airway pressure, or CPAP, which increases pressure of the upper airways above a critical value. If this pressure falls below the critical value, the airways collapse. This occurs most frequently during REM sleep, or rapid eye movement. Studies show that after 3 to 6 months of continuous CPAP treatment, patients experience an improvement in their memory, attention, and executive function. CPAP is typically a lifelong treatment, but patients who find the mask difficult to sleep with may result in other treatment options, including the simple tennis ball treatment, where a ball is strapped to the back of the head during sleep to inhibit patients from sleeping in the supine position or on their back. Also, a number of positional pillows may be effective. An alternative treatment method is mandibular advanced splints, or devices that are attached to both the upper and lower dental arches in order to move the tongue forward and increase the upper airway dimension during sleep. With a high correlation to floppy eyelid syndrome, dry eye treatments to include wearing a sleep mask at night would also be beneficial to the patient. If all else fails to be adequate treatment for obstructive sleep apnea, surgery is currently performed at the level of the nose, oropharynx tract, tongue, or craniofacial structures. Compliance with treatment for obstructive sleep apnea is a direct factor to prognosis. When patients make an effort to lose weight, live healthier, or utilize positive airway pressure each night, prognosis is very good. Even modest weight loss, or 10% reduction in body fat, can lessen the number of apneas per hour and lead to improved sleep. Obstructive sleep apnea can be detrimental, and it is important to look for ocular associations, such as floppy eyelid syndrome, in relation to sleep apnea, in order to help those people by referring them to proper caregivers for a sleep study. It is our obligation as optometrists to improve our patients' activities of daily living as best we see fit.
Here are our references for this presentation. Thank you for watching.